A lot of the issues that we're having right now with burnout and fatigue were building for years, and perhaps the pandemic was the icing on the cake.
A new national report from the Canadian Institute for Health Information says the physician shortage in Manitoba grew by 13% last year, with over 400 more doctors now needed to reach the national average.
The doctor shortage affects all Manitobans, all families, whether you're trying to find a family doctor, waiting to see a specialist, concerned about the overcrowding in the ERs, or stuck in the surgery and testing backlog.
Dr. Candice Bradshaw, president of Doctors Manitoba, says without a big change, the physician shortage is projected to get worse, with 43% of doctors planning on retiring, reducing clinical hours, or leaving the province. Bradshaw says 3/4 of them identified systemic and institutional factors behind their decision, including a lack of control over patient care, unreasonable on-call expectations, and excessive paperwork.
Yesterday alone, I had maybe 4 or 5 different insurance forms that were slapped onto my desk. One of them was actually very close to the 20-page mark. It's actually not necessary because I already know it's for a drug that is not approved by EDS in Manitoba. But filling out that form is required to be rejected so that an insurance company will go ahead and cover it for the patient. What an unnecessary waste of time.
Bradshaw says the province needs a streamlined agency that helps out-of-province doctors find the details associated with being a physician in Manitoba. She says they need to find a way to attract international doctors and needs to see the paperwork burden alleviated as soon as possible, something she says the government can do within the next few days.
When you look at BC and Alberta and Ontario compared to Manitoba, has other processes in place, if you're a family doctor, where you can see a patient with a lot more time now. And that's what patients want, and that's what physicians want.
Dr. Joss Reimer, Chief Medical Officer for the Winnipeg Regional Health Authority, seconds Bradshaw.
There's no question that we are seeing a shortage in family doctors, and we're very concerned about that. We want physicians who feel that their work is making a difference, who feel that their patients are well served, and who are seeing good health outcomes. We can give them the tools that they need to provide that care. We're going to see more doctors wanting to work here.
In Winnipeg, Mike Albanese, City News.